It's a scary time for trans people globally.
But the topic of gender has also been on the executive order list.
There are only two genders, male and female.
We can see the rising anti-trans rhetoric, we hear it.
It is the bombshell ban that has left trans teenagers in Queensland facing an uncertain future.
Dr Anya Ravine, a specialist in transgender youth health and wellbeing, discovered an alarming trend. Decades-old studies are shaping decisions affecting the lives of trans kids today.
One of the papers I came across was an old paper from 38 years ago, published in Australia, and it's become prominent again.
The 1987 report in the Medical Journal of Australia describes a little-known treatment program for trans and gender-diverse children. It ran from 1975 to 1980 at a state-funded psychiatric hospital in Perth.
They were referred to as gender-disordered children. It's implicit that they were expecting gender identity to return to what was expected. So that is really within the definition of conversion therapy.
The paper is currently being cited favourably by opponents of gender-affirming care in submissions to lawmakers, US courts, and medical regulators around the world. Even in Australia, the National Association of Practising Psychiatrists has written a clinical guide on how doctors should care for gender-diverse youth. It also cites the paper.
Efforts to suppress or change conversion therapy is illegal in many parts of the country. Also, we know now that people who've been exposed to this actually carry long-term psychological scars. It's very harmful.
The report, written by WA's then Director of Child and Adolescent Psychiatry Services, Dr Robert Koski, said the children's gender nonconformity was influenced by their parents.
It was decided that the way of dealing with this was to separate the children from the parents.
It referenced the experience of 8 primary school-aged children who were hospitalised, one at a time, for up to 6 months. 38 years later, Dr Anya Ravine thinks she may have found one of those kids.
When I looked at the actual admissions sheet, it actually stated on there that my reason for admission was to stop me from being transsexual in adolescence.
Through mutual friends, Anya came across Jane McFadgen. Jane was admitted to the Stubbs Terrace Children's Psychiatric Hospital in Perth in 1975. She was 10.
Good morning, I've got a journal reserved for Jane McFadgen. Thank you.
In the National Library of Australia, Jane can access the research paper.
No conscious attempt was made by staff members to encourage masculine or feminine role behaviours. Puh, that's wrong.
When I was young and knew the difference between boys and girls, I always thought for some reason my body was wrong. My mum caught me with some girls' clothing on, and being sort of mid-70s, not knowing what else to do, she went and spoke to our local family doctor.
Jane says once admitted, she was closely monitored by staff at the facility.
I was subjected to random checks of my clothing just to make sure I wasn't wearing any sort of female underclothes. Had to sort of go to the toilet if I was going to a cubicle, have the door open so they could check that I wasn't just sitting down to pee, that I actually stood like a boy and urinated.
After being hospitalised for nearly 6 months, Jane was finally allowed to go home.
When I came out, I had suppressed my sense of gender so far down because I was worried that I would be sent back to the psych hospital.
The study checked in on her 1 year later, and again when she was 18.
Age last seen 18. Cross-dressing recurred 3 years previously but stopped to its own accord.
After being discharged, it would take 22 years for Jane to come out. Before then, she fell in love and started a family. But over time, her wife Deb noticed Jane was hurting.
I said, look, what's going on, and she kind of told me, and then she told me what happened at Stubbs Terrace. So I said, oh, why don't you just like move out for a bit and decide who you want to be or who you need to be, and then we'll see what happens from there.
I was in a stage where I started suffering quite a major depression. My personal view was I could only see two ways out. One was suicide and the other one was to transition. After that, I made the decision to transition. I felt a lot lighter in myself, that I could finally see myself being who I always believed myself to be.
Jane, now 60, wasn't aware her experience at the facility may have been one of 8 case studies in Dr. Robert Koski's report.
The one I immediately identified with was case study 5.
Because of privacy laws, the actual names of the children who were admitted aren't accessible, but Jane's hospital admission and medical records align with case study 5.
10 male, well, that fits. I was 10 when I went there. Was females underclothes, wants to be a girl, yep.
From what I've learnt from Jane, these other people, it would be very surprising if they haven't had similar life experiences as Jane, and that is deeply troubling.
Now, Jane, Dr. Anya Ravine and a team of researchers have written a critique of Dr. Robert Koski's 1987 report. Ahead of its release, they've revisited the site of the facility in Perth.
At the front was the sort of living type space.
Supposedly they'd, in their words, cured me. I'll summarise it into their words as having cured me. And yet here I was trans.
Their report has been published in the Medical Journal of Australia today.
I think it's important for the lawmakers, the courts and policymakers to be aware of this report and to understand that past reports like this are really in the category of misinformation.
Dr. Robert Koski, the author of the 1987 paper, declined to comment. Through the ups and downs, Deb has been by Jane's side. They remarried in 2019.
Jane's outer shell was different, but intrinsically she was still the same person. And it was really nice for her to be able to be a bride as well.
I absolutely feel good in my skin now. I know who I am. I'm Jane. That is it. If you don't like me, you don't like me. If you do like me, you do like me, but this is who I am.
And if you need help now, you can call Lifeline on 13 11 14.